The homelessness crisis in Oakland, California. Oakland, California, like many cities across the United States, is grappling with a severe homelessness crisis. This issue has reached critical proportions, affecting the broader community and the city's social and economic fabric. Let's explore the multifaceted nature of homelessness in Oakland, looking at its root causes, the demographics of the homeless population, the impact on the community, and the efforts being made to address the problem. Oakland's homelessness crisis is strikingly visible and persistent. The point-in-time count is an annual survey mandated by the U.S. Department of Housing and Urban Development. The 2023 point-in-time count in Oakland revealed that there are over 5,000 homeless individuals in the city, which is a staggering rise from previous years. Oakland's homeless population has increased significantly over the past decade. This figure, however, only scratches the surface, as many experts believe that the actual number of homeless individuals is higher. It's difficult to count transient populations and those living in hidden or unconventional places. The crisis is evident, however, in the numerous encampments that have sprung up in various parts of the city. There's people under freeway overpasses, in public parks, on sidewalks, and more. Understanding the root causes of homelessness in Oakland requires examining a complex interplay of factors, including economic, social, and policy-related issues. Oakland, as part of the San Francisco Bay Area, is one of the most expensive places to live in the United States. The cost of housing has skyrocketed, with median home prices and rents far outpacing the incomes of many residents. This disparity has led to a significant portion of the population in being unable to afford stable housing. The gap between the wealthy and the poor in Oakland is widening. Many jobs available to low-income workers do not pay a living wage, making it difficult for these individuals to maintain housing. This is compounded by the high cost of necessities such as healthcare, transportation, and food. Saving money is almost impossible when everyday expenses outpace income. This makes it extremely difficult to cover the costs of moving to a less expensive area. People end up trapped in a nearly unbreakable cycle of poverty. A significant portion of Oakland's homeless people struggle with mental health issues and substance abuse. These challenges can make it difficult to maintain employment and stable housing. Access to mental health care and addiction treatment services is often limited, exacerbating the problem. Family breakdown, domestic violence, and other personal crises can precipitate homelessness. Individuals fleeing abusive situations or experiencing family conflicts may find themselves without a home. Imagine needing to flee from your home for your own safety, then find out there's nowhere else to go. The streets are no kinder, and it's much harder to get back into housing than it is to stay in housing. There is a severe shortage of affordable housing in Oakland. Policies that restrict housing development, such as stringent zoning laws and the slow pace of new construction, have contributed to the housing crunch. When available homes are going to the highest bidder, those with low income, poor credit, or a bad rental history won't have the means to compete. The support systems meant to help people in crisis are often underfunded and overstretched. Social services, including emergency shelters, transitional housing, and supportive housing, are insufficient to meet the demand. Those with special needs, such as wheelchair users, may find shelters unusable. Some temporary shelters only offer sleeping on floor mats, for example, which might be impossible for someone with limited mobility to safely access. Many shelters lock residents in through the night, eliminating them as an option for someone working a graveyard shift or a job that starts early in the morning. The demographics of Oakland's homeless population are diverse, but certain groups are disproportionately affected. African Americans are significantly overrepresented in Oakland's homeless population. While they make up about 24% of the city's general population, they account for nearly 70% of the homeless population. This disparity highlights systemic racial inequities in housing, employment, and access to services. Homelessness affects all age groups, but there is a notable presence of both younger individuals and older adults. Youth homelessness is often linked to family conflict, abuse, and aging out of the foster care system, while older adults may become homeless due to health issues, loss of income, or the death of a spouse. Single men constitute a significant portion of the homeless population, but there is also a growing number of homeless women and families. Women and families often face unique challenges, including increased vulnerability to violence and difficulties in accessing family-friendly shelter and services. Conversely, single women without children may find that women's shelters and services cater to those who care for kids. That leaves far fewer options for women who are alone. The homelessness crisis in Oakland impacts the broader community in several ways. Homelessness is a public health issue. The COVID-19 pandemic highlighted the vulnerability of this population and the public health risks posed by inadequate shelter and healthcare access. People experiencing homelessness are at higher risk for communicable diseases, chronic health conditions, and mental health issues. An injury that could be easily treated at home becomes a dangerous risk for those unable to keep a wound bandaged and clean. Diet is also a problem. Without means to store or cook food, eating a healthy diet is substantially more difficult, not to mention expensive. Inexpensive food and offerings available through soup kitchens and food pantries usually represents the least healthy options. This means obesity among the homeless is a growing crisis as well. Resources are spent on emergency services, healthcare, law enforcement, and sanitation. Additionally, the presence of visible homelessness can impact local businesses and the tourism industry, potentially reducing economic activity and tax revenue. According to a study by the National Alliance to End Homelessness, supportive housing actually saves taxpayers $4,800 per homeless person per year, compared to leaving those individuals on the streets. In spite of this savings, there is far from enough supportive housing available. Homelessness affects the social cohesion of communities. The presence of encampments and the sight of individuals living on the streets can lead to social tension and a sense of insecurity among residents. It also raises ethical and moral questions about the community's responsibility to its most vulnerable members. Communities install public benches that make sleeping impossible or enact ordinances that make camping illegal. Residents often protest affordable housing proposals in their neighborhoods, but also don't want homeless folks on their streets. It seems like the most common answer to where homeless people should be is somewhere else. Addressing homelessness in Oakland requires a multifaceted approach that includes immediate relief, supportive services, and long-term solutions. The city has expanded its emergency shelter capacity to provide immediate relief to those without housing. These shelters offer a safe place to sleep, access to basic necessities, and connections to services. In response to the proliferation of informal encampments, the city has established sanctioned camping areas with basic amenities such as sanitation facilities, water, and security. These are intended as a temporary solution while more permanent housing is developed. Increasing access to mental health care and addiction treatment is critical. The city is working with healthcare providers to integrate these services with housing support, ensuring that individuals receive comprehensive care. To address the economic factors contributing to homelessness, Oakland is investing in job training and employment programs. These initiatives aim to help individuals gain the skills needed to secure stable, well-paying jobs. Building more affordable housing is a cornerstone of the city's strategy. This includes not only low-income housing, but also mixed-income developments to ensure a diverse and inclusive community. For those who need ongoing support, permanent supportive housing combines affordable housing with case management and supportive services. This model has been shown to be effective in helping individuals achieve long-term stability. Addressing systemic issues requires policy changes at the local, state, and federal levels. This includes reforming zoning laws to allow for more housing development and increasing funding for social services. It's also vital to implement policies that help prevent homelessness, such as rent control and eviction protections. The role of community organizations, advocacy groups, and residents is vital in addressing homelessness. Organizations such as the East Oakland Collective and Operation Dignity work tirelessly to provide services and advocate for policy changes. Community involvement includes volunteering, donating, and participating in advocacy efforts to support those experiencing homelessness. The homelessness crisis in Oakland is a complex and multifaceted issue that requires a comprehensive and sustained response. While the challenges are significant, there are also numerous efforts underway to address the root causes and provide immediate relief to those in need. Through continued investment in affordable housing, supportive services, and policy reforms, and with the active participation of the community, Oakland can make strides toward reducing homelessness and improving the quality of life for its residents. The end result will be a more equitable and compassionate city where everyone has access to safe and stable housing.